Determining whether or not a substance abuse disorder is present can be tricky, but there are several criteria that you can depend upon. We know a substance use disorder is present when the substance is used excessively, especially if it's used specifically to produce psychological symptoms. But there are also some very specific conditions, some of which might have been included on the test for this material. You'll want to know the definition for withdrawal, and you're all familiar with that more than likely, that adverse physical and psychological state, symptoms that occur after reducing or ceasing your intake of a substance. And withdrawal is different from tolerance. Tolerance occurs when you need increasing amounts of the drug to produce the same psychological effects. And of course, you can have cross tolerance, where your use of one drug increases your tolerance for another, usually similar drug. And then we want to differentiate or distinguish between physiological dependence and psychological dependence, so that physiological dependence is when you need the drug to function physically, like is the case certainly with drugs like heroin. And psychological dependence is your need for a drug, your psychological sort of longing for it and desire for it, but not your body's physical need for it, where you get ill without the drug. So individuals diagnosed with substance use disorders have an inability to control their substance use despite the harmful effects, a craving for and preoccupation with their substance, preoccupation with obtaining it, and they will show tolerance and withdrawal. And you want to be careful about the different diagnostic categories within the DSM. In order to be diagnosed with dependence, you have to have a pattern over 12 months that includes withdrawal and tolerance.